Hi dudes, welcome again to my Oet channel. Today we will see another one letter discussion. Today's letter is one type of transfer or referral letter to the emergency department consultant on duty. So this is the letter to a doctor. Before proceeding further, we have to see the writing task. So let us see the writing task. Using the information in the case notes, write a letter of referral to the emergency department consultant on duty, outlining the case and requesting urgent assessment and management for pericarditis. It is a letter to emergency department consultant on duty, Newtown Hospital, 100 Main Street, Newtown. So why we have to go to the writing task first means, first we have to see whether it is a noun case or unknown case and to whom we are writing and what is our part and what is the requirement, and we will get the complete address also from this writing task. So from this writing task we came to know that we are going to write for a patient with the pericarditis, and the letter is a referral letter. It's not a noun case and it's mostly not a noun case. Then the letter is directed to the doctor who is in emergency department on duty in the specified hospital. Let us go to the writing content. Now you can read the complete writing sentences. You are a nurse conducting a nurse home visit as a part of routine follow-up care after this patient's recent hospital discharge. And you can see the assume that today's date is 30 August 2019. So this is the format what you will get in your exam question paper. There will be the date, mostly that date will be your exam date. So here we can come to know that you are the nurse conducting a home visit. During home visit, you find out something and you are going to write the letter to the doctor. So this home visit is already arranged from the hospital during the discharge time for the follow-up care. And you can see that I underlined with a red mark. So say in same way you can do it after downloading the question paper and taking the printout. So you will get much benefit if you are doing in this way. Patient details, we will see name Ms Patricia Stylessee, date of birth 27 April 1957, that is age 62. Address 57 Market Drive, Newtown. So this is not a noun case. Social background, we have to underline retired primary school teacher. That one we need. Lives on her own. That one also we need. Husband died 2 years ago because of lung cancer. No children. So we can sum up in our social history like a widow and who lives alone. Medical history, she has some disease conditions such as hypertension, diabetes mellitus, and this hypertension diagnosed 2011. It was mild at that time. 2013 it was moderate. Regular monitoring, currently well managed at around 140 by 90. That is his usual hypertension and usual BP. Then along with that she has diabetes mellitus type 2 diagnosed 2013, and 2014 they have started hypoglycemic tablets, metformin and glycoside, well managed generally. Another one more the past medical history they have given, that is depression, which diagnosed in June 2016, triggered by death of husband. Regular counseling since July 2016 to control mood swings and support DM management. So we have seen that patient has hypertension, diabetes mellitus and depression and on regular medications. Family medical history, mother has hypertension and DM. Lifestyle, smoking and alcohol, non-smokers, and for us no need 1 to 2 glasses per wine per week. That one we needed. Exercise, walks dog 20 minutes per day. Diet, ongoing counseling regarding DM management to maintain balanced diet, and the medication has given. These medications are important because we have to write it in the social paragraph. Quinalapril oral 40 milligram per twice daily. Metformin 500 milligram twice daily. Glycoside oral 30 mg daily. So these are needed for writing our social paragraph. Next we will see the presenting compliance. Green Valley Hospital treatment record has given here 23 August 2019, patient visiting sister for weekend. Sister lives 3 hours away from Newtown in Green Valley. Patient admitted to Green Valley Hospital late evening with a fever, sharp and pleuritic chest pain, which worsened breathing, general weakness, and malaise, tachycardia, rapid heartbeat. So these all we have to underline because these are the presenting complaint at the time of hospitalization. On the next day, on assessment, they could see that BP was 170 over 106, heart rate 98, temperature 39.3 degrees centigrade. They did the full blood examination, which in that you can see that increased ESR, increased CRP, increased WCC, and in the throat swab, viral influenza type B has confirmed. Chest X-ray was normal. Echocardiogram revealed pericarditis. So these are the main blood investigations, and the findings for us very much important is that throat swab finding and echocardiogram, because this is her diagnosis, like viral influenza type B plus pericarditis. Next, for the management, they gave an IV saline and ibuprofen 600 mg every 8 hours. On 25 August 2019, patient discharged and advised on self-care at home. Ms drove patient home and agreed to stay overnight for 3 nights. Follow-up nurse home visit arranged for 30 August 2019. So these are all the notes from the Green Valley Hospital. So they have managed and patient got discharged with the self-care at home. Since she's staying alone, actually the niece supposed to stay, and he agreed for only for 3 nights. And from the hospital upon discharge, they have arranged one home visit from the nurse. The nurse home visit arranged, which will be on 30 August 2019. And on that day, the nurse home visit finished, and this is the report, and that is your role. You are the one that home nurse. So upon home visit, what are the findings was relevant, we have to write in the letter. Observation: patient unhappy, reports feeling chest pain, relieved by sitting a position, shortness of breath, fatigue, frustrated with the progress of recovery. Medication adherence, reports compliance and regular blood glucose monitoring. Vital signs: there was low grade fever, elevated respiratory rate, heart rate, BP. Actually BP, the usual BP is 140 by 90, but today the BP is 125 over 78. Niece no longer staying overnight because of the work commitment in Green Valley. So patient presented very badly on the at the time of home visit. On assessment, patient is found to have unwell and there was no improvement. So nurse is suspecting whether it is a relapse or complications of pericarditis. So this is the recently present medical condition we have to write. Organize. So the plan is organize urgent hospital, transfer to Newtown Hospital, that is the nearest hospital from their home, while referral to emergency department include relevant medications, patient history, test results and observations. So we could see that during the home visit, these many things have found out. So the nurse is suspecting that there may be the relapse of the same condition or something is happened like a complication of pericarditis, and there is nobody in the home because the niece is no longer staying there because of the commitment with the work. So she could not leave as it is. So she planned to write a letter to the consultant at the emergency department in the hospital, Green Valley Hospital. In the writing task, you have to give importance for the medications, patient history and the test results, the observations, everything we have to include in the letter in detail. Once again, I will read the writing task. Using the information in the case note, write a letter of referral to the emergency department consultant on duty outlining the case and requesting urgent assessment and management. So this is the requirement for pericarditis. So address the letter to emergency department consultant on duty, Newtown Hospital, 100 Main Street, Newtown. So let us see how we will write the OET letter for this case note. Hi dudes, welcome. So we are going to write a sample letter to the emergency department consultant on duty to request an urgent admission. We will start with the date and address, 30 August 2019. Emergency department consultant on duty, Newtown Hospital, 100 Main Street, Newtown. So the letter format is, the date format is the date and the month, year. There is no comma, no bar, nothing. And in the address, there is no comma, no full stop, nothing. There is no doctor name, so we can write the emergency department consultant on duty, or else we can write the doctor's name and emergency department consultant. So here, as per the letter content, there is no doctor's name. Then we will write the salutation. Dear doctor, regarding Ms Patricia Stylessee, date of birth is 30 August. Date of birth is 27 April 1957. Same date format. We have to write it here. Next is the purpose paragraph. This is the important paragraph. You should not make any mistake here because there is the correlation between this paragraph and for the remaining paragraph. So here, as I told you in the last class, there will be mainly three sentences. One, we are introducing the patient with the full name and along with the patient's recent present medical condition, not the diagnosis. Okay, recent present medical condition and the requirement, what we are expecting from the reader, and this the referral or discharge status, it is optional. So how we can write in this case? I am writing to request an urgent assessment and management for Mr. Patricia Stylessee, who has possible lapse of pericarditis. This is somewhat a lengthy sentence, or else you can write, I am writing to refer Ms. Patricia Stylessee, who has possible lapse of pericarditis, full stop. She requires an urgent assessment and management from your service, full stop. She is said to be transferred into your care today. So like that also you can write, and in this way also you can write. So here I can say that the recent present medical condition is patient already got discharged from the hospital and now she is in home care. And during the home visit, the sister suspecting that it may be the relapse of pericarditis or the complication, because she is not the doctor to diagnose the condition. It's suspected cases only. So you can see that the question mark in the question paper, you can see that question mark. If there is question mark, there is a query, or if it is a written provisional diagnosis, means it is not confirmed case. You cannot write that this patient has this problem. So here you have to write it is like a suspected or possible. Possible and suspected same meaning. So here we can write has possible lapse of pericarditis. Then we are the requirement is an urgent assessment and management. So I hope this is clear for you. Once again, I will read for you. I am writing to request an urgent assessment and management for Ms. Patricia Stylessee, who has possible relapse of pericarditis. She is said to be transferred into your care today. Or else you can write, I am writing to refer Ms. Patricia Stylessee, who has possible relapse of pericarditis, full stop. She requires an urgent assessment and management from your facility, full stop. She is said to be transferred into your care today. Next, we will move to the present medical history paragraph. So, in this paragraph, we are going to write how the patient presented at the time of home visit, what all the complaints and what she did, or and what is why she is suspecting the things like that. So, this is the important content. So, here we will see what all things we have seen during the home visit. So, we will start like today, comma, during the home visit, comma, Ms. Stylessee presented with the chest pain, which relieved in sitting up position, shortness of breath and fatigue. So, these are all the presenting complaint when she came there. That means when you went there, you have seen that she presented with chest pain, but which relieved in sitting up position. Along with that, shortness of breath and fatigue. On examination, she is found to have, here we could not write she was found to have because we are writing the letter today. So, we can write she is found to have fever, tachypnea, tachycardia, as well as high blood pressure is 125 by 78 mm mercury, but which is lower than her usual reading 140 by 90 mm mercury. So, this aroused the doubt of relapse or complications of her previous diagnosis. So, because of these all sudden changes, because once after the treatment she came back to the home and she was compliant to the medication and everything, even though these all problem happen. So this aroused the doubt of relapse or complications of her previous diagnosis. So that means you are suspecting that it may be the relapse, that means again recurrence of pericarditis, or maybe the complication of pericarditis. So therefore so we can write one additional sentence. This is like a conclusion, as I told you in the last class. This is simple conclusion, it's optional. If you're writing like this, the letter will be look good, that means just for the presentation. Therefore, comma, your expert service is essential for her early recovery. This is nothing but just like with the politeness we are requesting again the requirement. So once again I will read for you. Today during the home visit, Ms. Style presented with chest pain which relieved in sitting position, shortness of breath and fatigue. On examination, she is found to have fever, tachypnea, tachycardia, as well as her blood pressure is 125 by 78 mm mercury, which is lower than her usual reading 140 by 90 mm mercury. This aroused the doubt of relapse or complications of her previous diagnosis. Here, no need to write pericarditis again because already we mentioned in the introduction paragraph. So, no more repetition, we can write just previous diagnosis. Therefore, your expert service is essential for her early recovery. Later, we have to give equal importance for the patient's previous admission because we could not exclude that content, because this pericarditis history started from that day when she got admitted in the Green Valley Hospital, that is on 23 August 2019. So we will start with that, why she went to hospital, with what complaints and what was the investigations done, and what was the confirmation diagnosis, what they did in the hospital, and at the end what they decided. That these all related to the previous hospital admission. Ms. Styles' problem started on 23 August 2019 while visiting her sister in Green Valley. So here, Ms. Style, apostrophe Styles, that is a name, apostrophe S should be there. In this cases, we can write Style apostrophe S. That means we have to pronounce it like Ms. Styles. So we will not write like that. So this, like this, we can write it in Oet letter. Problems started on we will start with the first date while visiting her sister in the Green Valley. She was admitted to hospital with the complaints of fever, pleuritic chest pain, tachycardia, and general malaise. So we included all important presenting complaints. Then next we will write about the investigation. So this is like story. What I told you, this is like a story. Patient came to see her sister, then got sick. Then she came to hospital, did some investigations. So that investigations are throat swab and echocardiogram. They did many investigations, but no need to write everything. Only the relevant things we can write it here. Her throat swab report revealed viral influenza type B and an echocardiogram confirmed pericarditis. So it is pretty clear that the patient have pericarditis related to influenza type B virus. Thus, she was managed with this is the management what we did. So we can use the connective thus, comma. She was managed with intravenous fluid therapy and ibuprofen. So passive voice have to be used here. That is, she was managed. Please try not to write IV. In short, just make expansion like intravenous fluid therapy and ibuprofen. Then we can tell that she was discharged home on 25 August 2019, as well as a nurse home visit was arranged for today. So because today is the date, we are writing the letter regarding everything. So we can mention like that. So upon discharge, she was advised for a home visit by the nurse, community health nurse. That was the end of her discharge. So I hope this is clear for you. Then we can go to the next paragraph. Next paragraph is our social history paragraph. Mr. Singh. Ms. Style is a widow and retired primary school teacher who lives alone. So we can write, because it's given already, she is a her husband died. So we can write she is a widow and retired primary school teacher who lives alone. She drinks 1 to 2 glasses of wine per week. So she doesn't have smoking habit presently, so no need to write, just we can write regarding the alcohol consumption. Then the next thing, you have to be conscious when you are writing regarding the conditions you are going to write. This is similar cases because she has hypertension, diabetic and depression. They have mentioned already the year from when it started, so we can write has had. Okay, please keep it in your mind. If the year written already from when, I mean the date or year or month, whatever, if it is given, you can write has had. If it is given only she has hypertension or diabetic or hypertension, but they didn't mention the year, you have to write has. So here she has had hypertension, type 2 diabetes mellitus and depression from 2011, 2013 and 2016 respectively. So please use that word respectively if you want to write two or three common things togetherly with the relevant other set of content. Here disease conditions and here we have to correlate, so we can use this respectively. And on medications such as quinapril, 40 mg, twice daily, semicolon, metformin, 500 mg, twice daily, and glycoside, 30 mg daily. So here that semicolon how to be semicolon how to become as a division of two medicines. All medicines you can write put by keeping commas like tablet name and the dosage and the duration, I mean the frequency, everything you can keep it like a comma within the comma. And after all medications, before starting the next medication, keep the semicolon. At the end you can use the like article aunt you can write. So this is the social history paragraph. Ms Style is a widow and retired primary school teacher who lives alone. She drinks 1 to 2 glasses of wine per week. She has had hypertension, type 2 diabetes mellitus and depression from 2011, 2013 and 2016 respectively, and on medications such as quinapril 40 mg twice daily, metformin 500 mg twice daily, and glycoside 30 mg daily. And here please try not to write BID, TID, OD. So please don't write abbreviations, just you can write it's like a expansion. So this is the social history paragraph. Last one is a recommendation paragraph. In this recommendation paragraph, we are going to write a letter to, we are writing a letter to the doctor. So this recommendation paragraph will be very small as in comparison with the nurse to nurse letter. It would be appreciated if you could take over the case of Ms Style and perform an urgent evaluation. There we wrote assessment in the introduction paragraph. So here we can just change assessment to evaluation. Then kindly provide specialized interventions as you feel appropriate. So this one you can by heart. For every doctor's letter, you can use the same sentence. So to nothing, we have to write only two things: urgent assessment and intervention management. For instead of management, we use the synonyms like intervention. And for the doctors, please keep it in your mind. If you are writing for a physician, don't write care. Care, it is only for the nurses and other professionals. For the doctors, we have to write management, interventions or treatment. So it would be appreciated if you could take over the case of Ms Style and perform an urgent evaluation. Kindly provide specialized interventions as you feel appropriate. Then just another one more thing, it would be greatly appreciated. Please don't write like that because it's already removed from OET. Don't use greatly. Simply, it would be appreciated if you could take over the case. That is correct. Next is a conclusion paragraph. This is common for all letters. Please don't hesitate to contact me if you have any queries. Then here actually the reader name is not given. They have given only the emergency doctor. So we can write faithfully. If the name given, you can write sincerely. So yours faithfully, there is no comma. Registered nurse, there is no comma. And this R and N for registered nurse should be cap lock. So this is our letter for the doctor in charge in emergency department. I hope this will be beneficial for your exam preparation. If you find it useful, please don't forget to subscribe to my channel and share it with your friends who are in need. Wait for another informative video. We will see soon. Until then, take care. Bye. So here